That was President Obama justifying the price tag on the health care reform package to a joint session of Congress last night. How will the government really pay for it? Welcome in right now Republican Congressman Brian Bilbray of California. Jeff Miles is a national health care analyst and the president of the Miles Organization, which works to set up customized health care plans with employers, and Fox News medical contributor Dr. Mark Siegel. Good morning, gentlemen. Good to see you guys.
Good morning, Alexis.
Congressman Bilbray, let me start with you. Are you any more comfortable today?
I'm very interested in seeing the president's proposal. What he talked about last night sounded really great, and it wasn't, though, what we've seen in the House. I mean, we haven't seen a bill that's going to be paid for. We haven't seen, in fact, the Waxman bill in the House, this whole issue about illegals getting benefits, the House bill specifically allows it. Actually, they defeated a motion to make sure that illegals didn't get it. I think that we need to see the president's proposal, and the concept that the deficit will not be increased will be interesting. And remember, the $900 billion, almost $1 trillion that he's talking about in the next 10 years, only has 5 years of this program in it. It's actually delays implementation. So we're talking $2 or $3 trillion within the next 20 years, which is a lot different than what we heard last night. And so I look forward to seeing what the president proposes, because what he was talking about last night was not what we've seen in the House of Representatives.
Yeah, it's not what you've seen in the House, but Jeff, I've read the pieces of Max Baucus's plan, and to me it sounded like his playbook. There were concessions on both sides. But I guess explain to us, if health insurers were to be the ones who are taxed the most, what do they stand to gain if, in fact, he does do what they've done with auto insurance, which is you're required to have mandatory insurance?
There's no doubt about it, Alexis, that there's a huge marketplace out there of people who are not currently covered. Some of them work for businesses who don't offer plans. Some of them are uninsurable because they have health problems. Some of them are unaffordables because they simply can't afford the premiums. But I think when you start looking at everything the president said last night, I agree with you. It was pretty much from Senator Baucus's playbook, except that he did, in fact, add the public option back on the table. But as I heard Bill O'Reilly say last night, I really didn't feel a sense of commitment from the president about the public option.
Yeah, I agree, too. I think he's easing the pedal off of the metal there, and you're hearing it from Steny Hoyer. When you hear Nancy Pelosi talk about a trigger, I think that's coming off.
Right.
Dr. Siegel, what you really care about is, are there enough doctors to insure? Are they going to get run over by malpractice issues? I mean, was that addressed appropriately?
Not really, Alexis. I mean, it's amazing to me. It's the central issue. I mean, you can provide, we were all talking here even this morning about insurance. Let's give everybody insurance, pre-existing conditions, you know, everyone's got this card now. But then they go to try to get care, and there's no doctors to take care of them. The American Association of Medical Colleges says that within universal health insurance, there's going to be a shortage of 150,000 doctors in 20 years. And what about the ones that are still there? They're not taking insurance. 50% of doctors don't take Medicaid. 30% don't take new Medicare patients in many areas. Over 10% are dropping out of private insurance. The ones that are in are gaming the system. If the reimbursements are cut, we were talking before about squeezing the system. You cut reimbursements to doctors, you cut reimbursements to hospitals, they're going to see more and more patients do less and less. That insurance card is going to buy you less and less, and there are going to be no doctors to take care of you.
Okay, if the malpractice insurance is so costly for these doctors, would you suggest then that a way to appease the medical community is to make sure that that insurance is brought down substantially? We know they're not going to go for tort reform, so let's address the real issue. Can we make it more affordable for doctors to properly insure themselves against a potential lawsuit?
Well, you know, there was a little bit of, the answer is yes, but there was a little bit of hand-waving at that last night, but not enough. I mean, one thing you could do is you could make the other side liable if the doctor wins, because the doctor wins in 90% of the time. Let them pay for their own costs.
Right.
Let them pay the doctor costs. cost. Another thing you could do is cut down on the amount of nuisance suits that you have by putting boards in every state, boards of doctors and lawyers that review cases before they can be brought, because 40% of all cases are nuisance cases. That's part of tort reform, but it could be done separately. I don't see that happening, and I think it has to happen.
I'm sorry, Congressman, you agree?
Alexis, you know, Dr.
In fact, Alexis, if you remember the speech yesterday, even the president was not brave enough to propose that tort reform be in the legislation. He said, let's do some pilot programs. We've already done that, 8% reduction in overall costs in Texas. So even this is a sacred cow that the Democrats will not touch, but it's a major component for health care costs. I was a county supervisor, provided the safety net for 3 million people in San Diego County. Tort is a major issue, and we're not talking about controlling costs. We're talking about mandates. An insurance mandate is an interesting parallel, because we're not talking about a privilege like driving a car on public streets. We're talking about the privilege is, you know, living in the United States is now going to be treated like driving a car, and that's absolutely absurd.
All right, Jeff, final word here. Why is tort a sacred cow? Why can't we make it more reasonable? Why is that such a big issue for Democrats? Is it because that's how they fund their campaigns? Explain this one to me.
Sure, of course that's what it's all about. Of course that's what it's all about. The reality is, as Dr. Siegel said very appropriately, you know, a loser pays system in this country would solve a lot of junk lawsuit issues, and it would really and truly deal with things as they truly are. No one's going to file a lawsuit unless it's real, if they may have to pay the freight. But I want to come back to this issue just for a second about the cost and about what Dr. Siegel said about the premiums. You know, if you read Max Baucus's plan, like I know you have, Alexis, when you look at things like 35% excise taxes on certain kinds of plans, who in their right mind believes that those costs would not be passed on to the buyer? It's incomprehensible that these folks are still not dealing with economic realities as they talk about these issues.
All right. Well, excellent points, gentlemen. We got a lot to talk about. This conversation is not over, that's for sure.